Good evening. I'm psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 26th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call here at PBS Fort Wayne by dialing in the Fort Wayne area 969-2720, or if you're calling anyplace else coast to coast, you may dial toll-free at 866-969-2720. Now, on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind@wfwa.org. That's mattersofthemind@wfwa.org. And I'll start tonight's program with a call from Tom. Hello, Tom. Welcome to Matters of the Mind. Tom, you wondered if adults on autism spectrum disorder can have successful careers. Actually, they can, Tom. People with autism spectrum conditions will often have disturbances in the right front part of their brain, among other areas. And basically, this is the part of the brain where people will mirror behaviors of others. In other words, they can pick up social cues. And the problem many people with autism spectrum conditions will experience will be they have difficulty with social cues. So they might not do as well in careers where they need a lot of interpersonal interactions, such that they'll have difficulty picking up the social cues in those ways, but they can be very focused on certain aspects in their environment other people might not notice. For instance, in the Israeli Defense Forces, they will use people in capacities who have autism spectrum conditions to be able to pick up a lot of intelligence that other people would notice. So, for instance, people with autism spectrum conditions will notice different characteristics in photographs that might not be apparent to anybody else. So they'll be able to do things very, very quickly and very efficiently in such a way that other people's brains just won't work. So autism spectrum conditions can have a lot of advantage. Many people with autism spectrum conditions will have marvelous mathematic abilities. It was thought that Albert Einstein had some autism spectrum conditions based on his personality and his interactions with other people. So people with autism spectrum conditions can have very successful careers. You just have to put them in the right spot to be able to do it. And it's like with all of us. All of us aren't really built or designed to be a one-size-fits-all. We all are tailor-made to be able to fit into certain positions in our careers, and the same goes for people with autism spectrum conditions. Tom, thanks for your call. Let's go to our next caller. Do we have another caller on the line? Ross, can you bring up these displays down here so we can look for our emails? Our next caller is coming in. It's I'm a Gene. Want to know what parts of the brain might be responsible when we're using them for singing. Well, when you're singing, you're using this right front part of your brain right up here. And when you're singing, you're using this part of your brain. When you're talking, as I am right now, I'm using the left front part of my brain. So that's why when people have strokes, and they have a stroke in their left front part of the brain, they will have difficult time articulating words. They'll be able to hear things just fine, and they'll be able to understand speech, but they have a hard time articulating speech because they have trouble using the left front part of the brain. So if somebody has a stroke in the left front part of the brain, they can't necessarily speak, but they can sing. It's an odd phenomenon. So they can sing, and you can ask them to sing the national anthem or happy birthday. They can sing just fine, but they can't speak. And that's because you sing mainly with the right front part of your brain. So it's an entirely different part of the brain. And when you think about the logical side of the brain being the left side and the artistic side being the right side, it makes sense because the singing part of the brain is on the right side. So that's the part of the brain that you use to sing. So thanks for your call. Let's go to our next email. We have an email question waiting out there. Our email question is, Dear Dr. Fawver, how does smoking affect your sleep? I've noticed that my sleep has gotten worse lately. Will it help if I finally kick my cigarette habit? Yes, nicotine tends to only last in the brain for a few hours. And here's what happens when you smoke nicotine. You'll have an energizing, activating effect. It's firing up dopamine and to some degree norepinephrine, and it's a very, very quick type of jolt of dopamine you're getting. When you use nicotine, the nicotine goes to the nucleus accumbens, which is in this middle part of the brain here. It'll fire up dopamine when nicotine hits that. But it lasts very, very briefly, and that's why over the course of time, you need more of a nicotine-like effect to get the same type of stimulation. Now, that's a very short-lived type of stimulation, so what happens if you smoke over 1 or even 2 packs a day, you'll notice you'll have this drop-off in the nicotine in the evening, and it'll actually wake you up. So that's why some people who are extremely heavy cigarette smokers will have to get up in the not middle of the night and smoke because their brain's going into withdrawal. And when you go into withdrawal from nicotine, you feel very anxious, you have some irritability, and you'll actually have some trouble with twitches in some cases. So people going through nicotine withdrawal will frequently awaken. So nicotine in the form of either cigarette smoke primarily, because cigarette smoke gets very, very quickly absorbed. Chewing tobacco has nicotine in it, obviously, and that will also give you that nicotine withdrawal during the nighttime when you're trying to sleep. So that will certainly interrupt your sleep overall. Thanks for your email. Let's go to our next caller. Hello, Jane. Welcome to Matters of the Mind. Well, Jane, you want to know is there any antidepressant medication that helps with weight loss? Well, Jane, that's a double-edged sword right there. So let's talk about depression and weight gain in general. When people get depressed, especially women, they tend to eat more. Men are more prone to eat less when they get depressed, but women especially are more prone to eat more, and they do more stress eating in general. So that's a factor we always have to take into consideration. Women will often, not uncommonly, have low thyroid while they're depressed, contributing to their weight gain. So one thing we need to vigilantly watch will be any evidence of low thyroid, especially for women. It happens in men too, but especially if you have a maternal family history of low thyroid, your mother had low thyroid, your mom's mom had low thyroid, we need to make sure the thyroid's in good shape. So if your thyroid's low, that will contribute to weight gain in general. So what kind of medications can we use for people who have depression and they're prone to gaining weight? Well, often we'll use medications such as bupropion or Wellbutrin. That's probably our number one means of appetite suppressant as an antidepressant medication. Matter of fact, bupropion, and the trade name there is Wellbutrin, bupropion is in a medication called Contrave, which is a combination of bupropion and naltrexone, which is an opiate receptor blocker. So naltrexone will give you a little bit of decreased appetite, bupropion even more so. Bupropion came out in 1989. And it was thought to be such a good appetite suppressant, they actually studied it in women who had eating disorders, who had tendency to overeat and binge eat and make themselves vomit. And for these particular women, they had a slightly higher likelihood than the rest of the population might be expected to have seizures. So they had more seizures when they used bupropion if they were having trouble with vomiting. So when we prescribe a medication like bupropion, we'll often ask people, have you had any seizures in your past, or do you have any difficulty with binge eating with vomiting? So we don't want people to have ongoing difficulties with seizures if they're taking bupropion, and we don't want them to have any difficulty with vomiting, because that maybe from an electrolyte disturbance, somehow, some way, set off their seizure risk. So bupropion is probably the number one antidepressant we'll use to suppress the appetite. Fluoxetine, also known as Prozac, came out in 1987, and it was thought to be a miracle drug at the time because it didn't work any better for depression than the older medications, but it helped people with more energy and it helped them suppress their appetites a little bit. So bupropion has a particular feature in it where it affects this particular serotonin receptor called serotonin receptor 2C. Now, serotonin has around 14 different receptors, and 2C is the name of the receptor. If you stimulate it, it can suppress the appetite a little bit. So Prozac or fluoxetine has been used for binge eating for some people, especially at higher doses. So that's a possibility for some people. Vortioxetine or Trintellix came out about 10 years ago, and vortioxetine also has serotonin and dopamine effects. We don't use it specifically for people who are binge eaters necessarily for that purpose, but it will not typically increase the appetite. And over the past year and a half, we've had another medication come out by the name of Auvelity, combination of bupropion and dextromethorphan, which is a cough suppressant. But at high levels, the cough suppressant, dextromethorphan, can help with depression and helping people put up with things. But the nice thing about Auvelity, it too will not typically increase the appetite appetite. So Jane, right now we're trying to look at chicken or the egg. Is the increase in appetite and weight gain due to depression? In that case, if you treat somebody with an antidepressant that does not cause weight gain, and you treat the depression, you'll often see an improvement with weight over the course of time. On the other hand, if the depression is being complicated by low thyroid, that will often be a contributor to difficulty with weight gain for a lot of people. Jane, thanks for your call. Let's go to our next caller. Hello, Danny. Welcome to Matters of Mind. Danny, you want to know what mental disorders cluster will pathological lying be somewhat of a symptom? Pathological lying, I wouldn't say, Danny, is necessarily a psychiatric disturbance. It's more of a moral or an ethical type of issue where if you're lying, by definition, that means you knowingly saying things that you know are not true, and you're doing it for the purpose of secondary gain. In other words, you're trying to get something from the lying itself. It is one of the 10 Commandments, and as a 10 Commandment, it's more of a moral issue than it is a psychiatric disturbance. So I wouldn't say somebody who lies frequently is psychiatrically disturbed necessarily. I'd say they're probably morally deficient in a sense that they are lying, knowing that if they deceive other people, they can get things for their personal gain. That's not a psychiatric illness. That's more of a moral type of issue, Danny. So we don't look at pathological lying as being a psychiatric disturbance. Danny, thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, is it harder to quit smoking? I have another smoking question there. Is it harder to quit smoking when you have other health struggles? Or is it just as well to tackle smoking and whatever else you are challenged to do? Yeah, when you're trying to quit smoking, we're going back to that dopamine effect again. When you're trying to quit smoking, number one, you can go through some nicotine withdrawal. Nicotine withdrawal is not pleasant. That's a key reason why people have a hard time going off smoking. So again, nicotine will stimulate this middle part of the brain called the nucleus accumbens. And to quit smoking, you need to dampen that activation down a bit, and you can do so with a medication by the name of Chantix. That's the brand name of it, which people typically know. Chantix has been around for 20 years now. It will give your nucleus accumbens the feeling that you're kind of smoking, but you're really not. It releases about 30% of dopamine compared to nicotine, so you're getting a little bit of output of the dopamine, but not as much as nicotine would do. And also, if you use Chantix and you do smoke cigarettes, it'll block the effect of the nicotine at the nucleus accumbens. So Chantix will give you a little bit of a spray of dopamine upon its use, but it also will block the effect of nicotine even if you do smoke. So you'll smoke a cigarette and you'll think, that didn't do much for me. So that's a way that Chantix helps people get off cigarettes. We will often combine Chantix with that medication I mentioned before called bupropion. If you add bupropion to Chantix, you'll have twice the likelihood of not smoking in the future. They do a really nice job in combination. Now, the biggest side effect of nicotine withdrawal will be nightmares. When people are going through nicotine withdrawal, they'll often have nightmares. It was originally attributed to Chantix, and then people at the Food and Drug Administration went back and re-examined the research data, which was very apparent. When you looked at Chantix versus placebo, both groups had a lot of nightmares. So the nicotine withdrawal is what causes the nightmares. So not uncommonly, as a means of preventing the nightmares related to nicotine withdrawal, we'll give people a really small dosage of a medication like Doxepin. Doxepin is a medication that helps with sleep, but it also suppresses dream sleep specifically. So that can be a way to get around that. So should somebody try to stop cigarette smoking at the same time of getting their psychiatric disturbance treated? Number one, you do need to get the nicotine withdrawal under control during that time with the Chantix, bupropion, maybe nicotine patches, but you can concomitantly give people psychiatric medications for the purpose of treating the underlying conditions that might be contributing to the smoking. Now, smoking itself will cause you to have the nicotine dependence, and trying to go off nicotine will be a problem for a lot of people, but many people will smoke nicotine as a means of helping with their mood and helping with anxiety, because nicotine can help with those kind of conditions. So if you treat the underlying conditions, not unlike many other substance use conditions, such as alcohol use, opiate use, even cocaine dependence for some people, if we treat the underlying conditions that are that are promoting those kind of behaviors will often try to get the heart of the problem itself. So I'm a big fan in helping people get off of nicotine. It's less prominent now than it was 20 years ago, but we have so many medications now that are much better at helping people get off the nicotine compared to 20 years ago overall. Thanks for your call. Let's go to our next caller. Hello, Mike. Welcome to Mayor's of the Mind.
Yeah, I had a question about the pituitary of the brain, if it could cause tremors in the arms. I have these tremors that aren't there all the time. They're just when I get my arms in a certain position. And I just wondered if that would have anything to do with that, if it's something going on there.
Mike, why would you think it's a pituitary gland? Have you identified there's a problem with your pituitary gland or anything like that?
Yes, I had an MRI, and they must have saw something there, so they're going to do another MRI with contrast and without contrast, because they must have seen something in that area, I guess, because I'd have tremor problems and also cognitive.
Okay. Are they identifying the tremors could have been related to the pituitary problem?
They haven't said yet.
Okay. The reason I mention that, Mike, is because the pituitary gland, as you know, is right there. It hangs down in the middle part of the brain, and it secretes a lot of different hormones, including thyroid-related hormones. It secretes prolactin, all sorts of different hormones. And if you have a secondary problem with those hormones, sometimes it can affect your adrenal glands, and thereby it can secondarily affect norepinephrine or epinephrine, all these different types of neurotransmitters that might contribute to a tremor itself. Now, usually a disturbance of the pituitary gland by itself wouldn't be a cause for tremors, but the secondary downstream effects could be a problem, such that if the pituitary gland is causing you high thyroid, well, high thyroid will give you tremors. If the pituitary gland is causing you to have excessive adrenal release of adrenaline, epinephrine, norepinephrine, those kind of chemicals, that can give you a tremor. So it wouldn't be the pituitary gland itself necessarily causing the tremor, but if there's some downstream effects from the pituitary gland, that could be a possibility. And the bottom line is, hey, you just want to get the tremors relief. So try to figure out what you can. I'm glad they were able to identify something on the MRI. The big issue now is let's get it fixed and go to the next step. Mike, thanks for your call. Let's go to our next caller. Hello, Carta. Welcome to Mayor's of the Mind. Well, Carta, you had mentioned that your son's taking clozapine and is still hearing voices. Is there any other medication that can be helpful? Clozapine, Carta, is a medication also known as Clozaril. It's been around since 1991, been around for a long time, and it's considered still one of the better medications for schizophrenia, especially when people have the ability to hear voices when nobody else is around, but they have trouble with maintaining touch with reality. Clozapine, as you are aware, needs to be carefully monitored for any disturbances in white blood cell counts, so that's why you have to get a blood test every week for the first 6 months, every other week for the next 6 months, and then once a month thereafter, watching the white blood cell counts. Clozapine is a medication that, as a side effect, can give you increased appetite and weight gain, and for some people it can give them cardiovascular problems. But otherwise, it's a very effective medication for schizophrenia symptoms. So what other medications can be used? Other medications that could be used would be one of roughly 16 different antipsychotic medications that are now available, and they all do work in different ways. There's to give you some of the trade names, some of the newer ones, Caplyta has come out that works entirely differently than clozapine. We have Vraylar, we have olanzapine, which has a chemical structure similar to clozapine, but olanzapine also can give increased appetite and weight gain. That's why there's another medication that's been added to olanzapine by the name of samidorphan. In combination, samidorphan and olanzapine is Lybalvi. Lybalvi will give you the benefits of olanzapine without the increase in weight. So that's another option as well. Sometimes people will add different medications to clozapine, like Abilify. That's actually been studied using it with clozapine, but bottom line is you have to get the ideal dosing of clozapine first and foremost. And the nice thing about clozapine, there are blood levels that can be obtained with clozapine where people can identify just how much exactly they need without getting toxic on it. But sometimes you have to be kind of creative in terms of adding other medications to clozapine, but it's still considered one of the better medications out there for the symptoms of schizophrenia, including hallucinations, as well as delusions and difficulty with socializing and being able to maintain contact with reality in general. Carter, thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, I heard you talk about sleep paralysis a couple weeks ago. What's the chemical cause of sleep paralysis? The sleep paralysis is basically where you awaken, typically after you've been dreaming, and all of a sudden you can't move. Now, while you're dreaming, you should have sleep paralysis. That's a normal type of phenomenon, but some people will awaken and their brain will be awake, but their brain is still kind of in that dream state where they're still paralyzed, and it might take a few seconds for them to come out of it. It's kind of scary for some people, but it does go away, and it resolves within a matter of seconds. The two chemicals, primarily the receptors involved in sleep paralysis, will be, it's like the nuclear missiles where you need the two keys to actually engage it. That's kind of how sleep paralysis works. To go into dream sleep and to have the sleep paralysis, you need to have stimulation at the glycine receptor and at the GABA A receptor. So you stimulate both of those receptors and you will have sleep paralysis. Not just glycine, not just GABA. You got to stimulate both of them. So the reason why people will awaken sometimes with sleep paralysis is because they're still dreaming. Why are they still dreaming? And why are they awakening at that time? It's often because they haven't been able to get enough sleep. So sleep debt will often cause you to get a little bit more dream sleep than you ordinarily experience. That's what often happens when people have difficulty with the non-REM related sleep disturbances, where they're sleepwalking, or they're having night terrors, where they are sometimes very confused in the middle of the night and they might scream out, and they don't remember what's been going on. It's an entirely different phase of sleep compared to dream sleep, but that's from sleep deprivation. So if you have sleep deprivation and you haven't been getting good sleep, and you're trying to make up on your sleep, you'll have sometimes more sleep paralysis. But it's two chemicals involved, the glycine stimulation, the GABA stimulation, both at the same time, giving people difficulty with sleep paralysis. And it's something people not uncommonly will experience if they've had sleep deprivation. Rather than treat it with any particular medications, we prefer just to take a look at a person's sleep hygiene and see if we can do anything we can to get them to go to bed the same time every night, get up the same time every day, try to get back on that good sleep-wake cycle so they're not having difficulty with sleep paralysis. Now, there is a phenomenon where people can have a bit of sleep paralysis when they're having a narcolepsy event. That's another reason why people can have sleep paralysis. Narcolepsy is where your brain, in the middle of the day, just goes into dream sleep. And when your brain goes into dream sleep right in the middle of the day, you can briefly forget what you've been saying for a few seconds, but your knees will buckle on you. When your knees buckle on you, that just means your body's starting to go in paralysis. So it's very quick, it's very brief, but that's called narcolepsy, and that is happening because your brain's going into REM, a REM cycle, even though you should be wide awake. And there's medications that are given to people who have narcolepsy to keep their brain more awake during the day so they don't go into the dream sleep like that during the daytime. Thanks for your call. Let's go to our next caller. Hello, John. Welcome to Matters of the Mind. John, you had mentioned...
Hello?
Oh, hello, John.
Yeah.
There you are.
Yeah, I'm addicted to milk. Is there anything? I mean, 2 gallons a day at least. Just like an alcoholic's addicted to liquor, cigarettes, or whatever. Is there anything I can take?
John, what do you like about milk?
It soothes my stomach. And I mean, I'm just addicted to it. I catch all kind of flack from my girlfriend because I have sugar, and I just can't get off of it.
I was wondering if the milk, if it was chocolate milk or flavored milk, I'd be more concerned. But you've got some of the carbohydrate effect of milk that you're enjoying. You've got some protein in the milk, which is actually a good thing. You're enjoying that. You got some calcium. Milk is not the worst thing to be using excessively, but you're not likely addicted to it, John, unless I know you're drinking a lot, but you're not likely addicted to it unless you're drinking more and more and more of it, and it feels out of control where other people are saying it's causing you problems with being able to do things in your day-to-day life. So when we talk about the term addiction, it means you keep doing something even though it's causing you problems at work, in your day-to-day lifestyle. Also, when people are addicted to something, they continue to exhibit the behavior and do it while hiding it from others. So if you're hiding milk in various parts of your house, in a refrigerator in different places of your house, for instance, as a means of hiding it from others, that would be an addiction itself. But you're saying that you like milk because you like how it feels in your stomach? I think you're basically self-medicating a little bit of gastritis there. That's not all bad, John, if it helps you feel good, as long as the milk is not causing you social difficulties, getting to work, or having other problems in your life. John, thanks for your call. Unfortunately, we're out of time for this evening. If you have any questions that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.